The young lady was very persistent also. The mother and I were having some issues as far as communication, as far as relationships, his status was concerned.
Yeah, can I stop you for a second, Mr.
Yes,
Mitchell?
ma'am.
And I'm gonna revert back to my colleague. You were talking about a 13-year-old and you were what, 37?
Yes, ma'am.
Okay.
So Ms. Chance is bringing to your attention, I think what all three of us are thinking, that a 13-year-old cannot be very persistent when it comes to having a sexual relationship with somebody in their 30s, late 30s. And I'm going to go back to what I said to you a few minutes ago, is that having participated in the treatment program, part of the goal and of that program is for you to appreciate, that what your role in all that is, and not be blaming the victim, because you've done that sort of right along. You've blamed the victim right from the beginning, and nothing much has changed. And I'm sure having a young daughter, you can see why you cannot blame a 13-year-old for this offense. And that's what you just did, which kind of undoes all the treatment that you had.
I'm sorry for what happened. I can't take it back. It's already happened. I can promise you and guarantee you that it will not happen again. Like I said, I'm not a troublemaker. I'm not a person that goes looking for trouble. I'm not a person that goes out there and says, I'm going to do this today. I'm going to do that today. I'm going to do this to this person. This has been my first time in jail. I know it's a very serious offense. I know it's.
What do you think makes it so serious, Mr. Mitchell?
The fact that there were relations with someone who is underage, number one. Number two, that was someone else's child. So that's first and foremost my child.
Assault on the victim are?
She's going to think about it a long time. She's going to be very hurt. She's going to be questioning anybody that is in that authority figure, whether she's going to be abused, she's going to be, ever put in that situation again. Her mentality is probably going to be questioned. She's going to suffer.
Do you feel like the treatment program was beneficial at all?
Yes, I do.
Why?
I believe it was beneficial because I see the wrong in what I did. I see that in that authority figure, I should have never, ever considered or thought about any of that. That being in that parental role, what I did was totally and utterly wrong.
Over the course of several years, during that time frame, did you ever step back and ask yourself what was wrong about this situation and what you could do to change it?
Once, yes.